Good afternoon, Long Beach. Mayor Robert Garcia going to give you another update today, and I'm also joined by Dr. Davis, who leads our health department response, and Dr. Davis is here with us. And also with us is Alice, who does our translation. She'll be translating in Spanish after we've gone through the whole update and the questions. So en español, después que eso termine, también vamos a tener en español. And then, of course, Paola, who's behind us, who's doing our ASL sign language. And so thanks to all of them. Good afternoon. I want to remind folks that we do these updates every Monday, Wednesday, and Friday, and they are done at 3 o'clock. You can watch them on the city's Facebook page. You can watch them on the city's Twitter handle, or on LBTV Channel 3, which is on Spectrum Charter. And all those are done live at 3 o'clock every Monday, Wednesday, and Friday. I want to just begin by sharing that the city of Long Beach now has 139 cases to report that are positive as it relates to COVID-19. As you've probably noticed, this is a number that continues to increase on a daily basis. Quite frankly, it's on throughout the day. We see increases, and we should expect that number to continue to increase exponentially in the days and possibly weeks ahead. We know that we are headed right now to a critical few weeks where our hospital system is expecting a surge, and where we're expecting to see more and more positive cases throughout the city of Long Beach, and of course throughout the state of California, as well as the county. We want to report that as part of that. And while this number is not a completely accurate count, but we approximately know that about 35, 40 of these individuals have recovered from COVID-19, that believed to have had a full recovery. And so that number fluctuates, but that is a positive sign for some folks that are getting past those positive cases. I want to share also that we've had 3 additional Long Beach firefighters show positive for COVID-19. We know that this brings the total to 18. This is a serious and high number for the Long Beach Fire Department. We have an excellent department, men and women that are rushing towards danger, that are protecting us in our homes, and that are responding to these calls for service, ones that relate to COVID-19 and other calls for service. And so we have, and we believe that we, of course, have located the main source where a lot of these transmissions were happening, which was at Station 11 in North Long Beach. Of course, that station has been thoroughly cleaned, and firefighters have been getting tested. And those that have shown symptoms, we have, of course, are self-isolating and quarantined at home and are doing okay and doing well. And so we're thinking about them. Of the 3 that are new cases as of today, 1 of those 3 live in Long Beach. So that member of the fire department counts in our 139 total, and the other firefighters will count in totals for their own city. So that's the way the total count actually works. I also want to share that, and this is really sad to report, we've had our second death as it relates to COVID-19. This is a woman that was in her 60s, and so she had also some underlying conditions on some other health issues, and so she has passed away. This is now our second death in Long Beach as it relates to COVID-19. And a note that both of these individuals that passed away had other complications and other health issues that they were dealing with. Please remember that it's incredibly important that we take care of our families, especially our seniors. Our hearts and our thoughts, our prayers, our good love is going to their families and to all the men and women that are at our hospitals taking care of them. And so we want to be very thoughtful. In addition, I just want people to know that of the cases that we are also looking at right now, 2 of the new cases that we are reporting are senior cases that were their seniors that were in 2 separate senior care nursing facilities. And so this is something that is really critical for us, because we know when a senior is in a facility and they're in close contact with other seniors, there's a high possibility for serious transmission, but also that we have a vulnerable population. And so our Long Beach Health Department Other physicians and doctors that are all part of our teams are right now working at these senior nursing facilities, obviously working with the other seniors that are there, with the nursing staff, with the staff that is there to ensure that we really understand the impact at these two facilities. And so that's something that we're taking very seriously. And the health department is working right now on all these interviews and this process as we speak. We want people to know that we are also taking the stay-at-home order very seriously. There are some additional shifts and changes to the stay-at-home order, which I want to share. This is aligned with what the entire county of Los Angeles is doing as well as it relates to self-quarantine and self-isolation. Effective tonight at midnight, our Long Beach Health Department is going to be issuing new orders that any individual with COVID-19 has to self-isolate. This is something that we have also obviously been asking in the past, but now it's going to be part of the official health order. And if you've been exposed or at risk of COVID-19, you also need to self-quarantine and to work with your physician and health provider so that you understand the length of time. But it could be, of course, up to 14 days, depending on where you are in that cycle. And so if you have COVID-19, if you've been at risk, while we have asked in the past to stay home and self-isolate, it'll now be an official order as of midnight tonight, as is doing LA County, just to make sure that people are following the law as closely as possible. Want to also share a few other items of information that are important. We just launched a program which we're really proud of called Work Long Beach that's really focused around childcare. We launched the program just yesterday, and now we are matching up out-of-work childcare providers, professionals with organizations, businesses, hospitals, public safety officers that are looking for child care. And that is the Work Long Beach program. So if you're an out of work or unemployed child care provider, we want to get and ensure that our doctors and nurses, firefighters have child care while they're responding to COVID-19. And you can go to longbeach.gov for more information and to sign up. Another piece of which I think is good news is I want to share for those of you that are worried about animals and animals in our shelter. I'm also pleased to report that right now our shelter is seeing historic rates of adoption and fostering. We are clearing out our shelters. Animals are going to different homes. People are coming in to foster. There's still animals available at the shelter. But I just want to thank the community for also taking care of these animals, these pets. They're part of our families in many cases. And that is something that's been positive that's come out of all of this. I want to also update folks on farmers markets as well as these restaurant pop-up markets that are happening. We need to understand that in Long Beach, we have our own health department, as does the County of Los Angeles that encompasses the city of Los Angeles. And while Long Beach is a part of the County of Los Angeles, our health department acts as a separate body because we're our own, obviously large city of about 500,000 people. And so oftentimes, if the city of Los Angeles or the county put out a health rule, it doesn't necessarily always apply the same in Long Beach. But we try to align ourselves as much as possible with the county in LA because we think that one approach is the best approach. But you might sometimes hear slight differences, and this is one I want to just share as it relates to farmers markets and pop-up markets, what we're doing in Long Beach. Some of you have noticed that some of our local restaurants, our most well-known local restaurants, have opened up small pop-up markets or bodegas in their patios or in their restaurant where they might be selling fresh fruits or eggs. They might be selling pastas that they would normally maybe make in their restaurant. These small pop-up markets, we are trying with our health department to allow them to continue. We think they are doing a good job of physical distancing. They're putting in good health rules. So we're working with them to see if they can continue. We'd like them to because we think they're an important part of food access. But we're also asking the public to please physical distance and follow the rules, because if that starts being a problem, then we're going to have to take more aggressive action with those. But we're trying to support our restaurants and you, the public, that needs access to those fresh foods. The same goes for our local farmers markets. We know that our farmers markets right now are outside. They are practicing physical distancing. I think every day that they operate, they're getting better and better with the rules to help people buy fresh foods. And we know they're an important access point for fresh foods. We have heard from a lot of people in the community that they prefer going to their farmers market than even going to some grocers for some folks. So we want to provide that option to get those fresh foods if possible. And so we're working with our farmers markets on physical distancing rules, and so that there's very little interaction between the customer and the actual food. So please help us with that. And again, if the health department in the next few days realizes that it's not working as a farmers market system, that people aren't following the rules, then we're going to have to close those down, and we're going to have to close down the pop-up markets. And so please work with the vendors, and let's together try to support these small businesses and these local farmers and the access to food. I want to also just add that one of the other things that's really important for us as we move forward is to stay informed. We want to make sure that people in the city have access to information. Our COVID-19 website is a great resource, but we'd also like to ask all of you to sign up for Alert Long Beach. You can access Alert Long Beach from the longbeach.gov website. And what Alert Long Beach does is we're able to send you a text immediately or a phone message, or we're able to email you critical information in the weeks ahead. And some of you already signed up, so you receive texts from the city. But if you'd like to sign up, I would sign up for Alert Long Beach. You can sign up for that at the city's website as well. And today I want to also note a few other things, but one that's really important. That is that we are, as we know, in this health crisis right now, that a lot of us are dealing with and adapting to in our daily lives. But there's another important critical function happening right now that I'm asking you to please participate in, and that is the 2020 census. The 2020 census, believe it or not, is critical to the future of the city. And why is that? When we're all counted, that count directly impacts the amount of federal funding for healthcare programs, education programs, other types of programs that the city actually gets and receives. And so the census is more important today because of this health crisis than it ever has been before. Because we know that in the future, counting everyone to ensure we get our fair share from the federal government is going to be critical. We know that in the past we have been undercounted, and being undercounted has impacts. And so we got to make sure that we count every single person as part of the census. You can take literally 5 minutes and fill out your census online. You can go to my2020census.gov. That's my2020census.gov, and you can do your census form right online. I did mine online, and it took me 5 minutes. You also have received by mail your census form. You can do it by mail. You can do it by the phone in some instances. There's a lot of ways to get support from organizations to fill out your census, but doing it online is the best way to do it. So I'm just asking you to please be counted, and it's going to help us as part of our overall planning purposes. At this time, I want to introduce Dr. Davis, who's going to talk a little bit more about what we're doing as it relates to health, and I want to thank her for all her work as well. Dr. Davis.
Thank you, Mayor. As the Mayor shared, as of this morning, we have 139 individuals who have tested positive for COVID-19 in Long Beach. I want to personally offer my sincerest condolences to the family of the woman who passed yesterday evening. While approximately 30 cases have been cleared, meaning they're no longer contagious, COVID-19 continues to present a very real and serious threat to the health of everyone in Long Beach. There's currently no medication or treatment for COVID-19. Because the virus is so new and there's no vaccine to prevent disease, everyone is susceptible. The best way to prevent illness is to avoid being exposed to the virus. This pathogen spreads easily through respiratory droplets from an infected person when they cough or sneeze. These droplets can be inhaled directly from someone who is within 6 feet of a contagious person, or they can land on surfaces, resulting in later infections. Protecting ourselves, our households, and our community comes down to each of us following the guidelines to self-isolate when we're sick and self-quarantine if we've been in contact with someone who's sick. We will be issuing an order requiring individuals with or likely to have COVID-19 to self-isolate, and an order that requires close contacts of these individuals to self-quarantine. Close contacts include individuals who live together, intimate partners, and anyone who's been within 6 feet of a contagious person for more than 10 minutes, and anyone who's been exposed to the sneeze or cough of a person with or likely to have COVID-19. Even people who have not been tested but are exhibiting symptoms of COVID-19 should isolate themselves at home until they're cleared and notify any potential close contacts that they should self-quarantine. I know the terms isolation and quarantine can be confusing, so I'd just like to take a couple of minutes to differentiate what the difference is. So isolation really refers to what you do when you actually have the disease. So in this case, COVID-19. So isolation when you have COVID-19 means to physically separate yourself from others who are not infected. So in this case, people sick with COVID-19 should self-isolate for at least 7 days from when they were first symptomatic until at least 72 hours after their symptoms have resolved without the use of any fever-reducing medication. Quarantine, on the other hand, applies to a person who's been exposed to somebody with the disease but who's not sick. And what you do in this instance is it refers to separating and restricting the movement of people who might be infected so they don't potentially spread the virus to others. People who have been in close contact with someone with COVID-19 should self-quarantine for 14 days from the date that they last had contact with an ill person. So that way, if that person should later become ill, they've quarantined themselves so they're not passing it on to others. As we continue to see increases in cases in Long Beach and nationally, it's increasingly urgent that those who are not isolating or quarantining need to practice physical distancing. The fewer people that get within 6 feet of each other, the fewer people that can get infected, and the fewer people that get really sick and become hospitalized. Continue taking the necessary steps to slow the spread of COVID-19. Here are a few reminders. Wash your hands and surfaces frequently. Only leave your home to conduct essential activities like grocery shopping or obtaining medical care. If you feel like you either have respiratory symptoms, you need to always call your doctor before you go to the doctor. And when you must leave your home, stay at least 6 feet away from anyone outside your household. If you're sick, cover your coughs and sneezes, stay home, and separate yourself from others in your household as much as you can. Please continue to stay informed and up to date on COVID-19 by visiting www.longbeach.gov/COVID-19 or call our COVID-19 info line at 562-570-4636. You can also follow at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
We're going to answer a couple questions that have been sent in by members of the media. So go ahead, Jacob.
Dr. Davis, can you provide more detail on the 2 care facilities where they were confirmed cases, such as the names, what type of care they provide, what steps have been taken to protect the other patients there, and whether there may or may not be other cases pending?
So I can tell you that one of the facilities is a skilled nursing facility and the other facility is an assisted living facility, and they're both in Long Beach. And when there's a case, because both of these facilities are very considered very high risk because of the vulnerable population that live there. So we are providing a lot of our resources to identifying other people who may have symptoms making sure that we get them tested expeditiously, and making sure that we provide the proper PPE for the residents and the staff who are there in the facility.
Thank you. Dr. Davis, is there any more information you can provide about the second death? For example, how long was she sick and how did she contact the virus?
Right now, the only information I can provide for you is that she was a female in her 60s, and she had underlying health conditions.
Dr. Davis, can you elaborate on how many confirmed cases are currently being hospitalized?
As of today, approximately 17 individuals are hospitalized with COVID-19.
Dr. Davis, does the health department know yet where the cases in long-term care facilities originated?
Not right now, so that's part of our investigation, is interviewing all the residents and the staff and kind of tracing movements to help us try to figure out what the source could be.
Mayor Garcia, does the city plan on expanding drive-through testing soon?
We are, and so I know I talked about testing on Monday, and I'll expand a little bit on it as well. And after talking to Dr. Davis today, our numbers are shifting as well as far as the tests. I had mentioned that we had done, as of 2 days ago, we had done a total of about 1,300 tests for COVID-19 between our Long Beach lab and our public and private health partners. And so it's not just the Long Beach lab, but it's our health partner labs that we send tests to. It could be a direct doctor that sends a test, could go through the hospital, or it could have been that we have sent it through our system. And so we had done about 1,300. We believe that number today is closer to about 1,500. So we've done about 1,500 of these tests in Long Beach. Separate of the 1,500 tests, we know that we have 500 full test kits in stock in Long Beach that we are using and will be using to test more individuals as the days move forward. And that we have, in addition, separate of the 500, an additional 1,000 tests that are waiting for a final piece of the test to make those active. And so we have 500 active tests that we're using. We have an additional 1,000 that once we get that piece in, will also become active. So that's the full kind of testing kits that we have and the amount of tests that we're doing. But we are ramping that up. And so you will see a ramping up of these tests. We do have one current drive-through and drive-up testing facility at the Long Beach Health Department. That is by appointment only and only being done through doctor or hospital referrals. We are working with the Los Angeles County right now and are working on acquiring more tests. And as soon as we have the amount of tests that we need to open up drive-through or drive-up testing facilities, we will do so. But we have to have enough density of tests to do that. I will say that what we're doing as a city is we have, of course, been dependent on the CDC and our federal partners to send us tests, as has every city and every county in the country. We continue to do that, but we also are not just waiting around for those tests to arrive. We are being as aggressive as anyone in reaching out directly to test suppliers, directly to the testing companies, where we have a team at the city that is just focused right now on purchasing. And we're not just focused on just purchasing and trying to acquire more tests on our own. We're also looking at purchasing and acquiring other types of PPE that Dr. Davis talked about, which is masks and gowns and other materials that our hospitals and health providers need. And so I think for a lot of us, we were hoping that the federal government would provide adequate testing, and that's been, I think, something that has been frustrating for the last few weeks. And so we are still working with our federal partners, but we are also aggressively looking at acquiring all of these on our own. And so as soon as we can do more testing, we will do those.
Mayor Garcia, this is a question from Facebook Live, and it says, will schools be closed until August? And will kids need to repeat their coursework?
So as it relates to schools, decisions about schools are really made at the local level, and the Long Beach Unified School District will make the official last decision as it relates to school closure. We know as of right now that Long Beach Unified, that schools are closed throughout this entire month. We expect that Long Beach Unified, when they are ready, will be putting out more information about school being out longer or exactly when school will be back in session. Obviously, we've probably heard the governor and the state superintendent make announcements and certainly give ideas about how long school will be out. But we're not sure yet completely in Long Beach, but we do know that Long Beach Unified is working on this. And certainly students aren't going to be going back in these next few weeks. We do know that Long Beach Unified is still out, and they are communicating directly with parents. As it relates to kids' preparation, that's really up to the school district. We're working with them as partners, and they're working directly with parents to ensure that every kid gets the education, even during this time, that they deserve.
Dr. Davis, another question from Facebook. Is it true people lose their sense of smell or taste prior to COVID-19 symptoms?
That is a commonly reported symptom that people are saying happens.
All right, thank you. That goes and does it for the questions. Thank you very much, panel.
Okay. Thank you. We're going to go ahead now and have a summary of the update in Spanish. And so I want to turn this over to Alice. Thank you.
Hola, muy buenas tardes por acompañarnos hoy otra vez. A partir de esta mañana, nuestro Departamento de Salud y Servicios Humanos de la ciudad de Long Beach ha reportado 139 casos positivos del COVID-19. Este número sigue creciendo día a día. En esos nuevos casos incluyen los tres bomberos más de la ciudad de Long Beach, incluido uno que vive en Long Beach, trayendo nuestro total de bomberos a 18 para la ciudad. Y es también con mucha tristeza que informo que ha habido una segunda muerte de un residente de Long Beach. La persona era de tercera edad y tenía problemas de salud subsiguientes. Ella falleció en el hospital del condado de Orange. También me gustaría compartir brevemente sobre un nuevo pedido que entrará en vigilancia desde esta noche a las 11:59 p.m. Es un esfuerzo continuo para frenar la propagación del COVID-19 que entrará en la ciudad de Long Beach. De nuestro Departamento de Salud emitirá una orden que requiere que las personas con COVID-19 se autoaíslen y aquellos que han estado expuestos y que puedan estar a riesgo de tener el COVID-19 a la autocuarentena. Tendremos más información sobre esto esta noche también. Lo más importante es entender la diferencia entre el aislamiento, que es la separación físicamente a las personas enfermas que son contagiosas de otras que no estén infectadas. En este caso, las personas enfermas de COVID-19 deben autoaislarse durante al menos 7 días desde el momento en que fueron sintomáticos por primera vez, hasta al menos 72 horas después de que sus síntomas se hayan resuelto sin el uso de medicamentos. La cuarentena, por otro lado, separa y restringe a las personas que podrían estar infectadas para que no puedan transmitir el virus a otros. Las personas que han estado en contacto cercano con alguien con COVID-19 deben someterse a cuarentena por 14 días para partir de última vez que tuvieron contacto con una persona enferma. A medida que seguimos viendo aumentos en los casos de Long Beach y nivel nacional, es cada vez más urgente que aquellos que no están aislados o en cuarentena necesiten practicar el distanciamiento físico. Cuantas menos personas se acerquen 6 pies entre sí, menos personas pueden infectarse, menos personas enfermas y menos necesitan servicios médicos en un hospital. También quisiéramos dar unos datos de información sobre las personas que disfrutan y hacen sus compras de mercados y agricultores locales, para informarles que sí han salido más mercados y tiendas como bodegas en estos restaurantes. Por eso es para la ayuda, para que nuestros residentes podamos cubrir recursos esenciales como nuestra comida. Por ejemplo, como nosotros somos, nuestra ciudad de Long Beach tiene su propio departamento de salud, estamos trabajando juntos para asegurarnos que esto sea seguro, y si tenemos que hacer unos cambios, eso saldrá más en el futuro. Entonces, nomás queremos recordarles que obedezcan las órdenes que están teniendo estas bodegas y estos restaurantes, que en cambio han tenido que cambiar en vez de hacer ofrecer comida, están vendiendo ingredientes para hacer sus propias comidas. Mientras tanto, otra cosa que es muy importante, que hoy, el 1 de abril, es el Census. Es muy importante que los datos del Census son fundamentales en determinar los servicios que nosotros necesitamos en nuestra comunidad. Algunos de estos recursos proporcionan servicios esenciales que actualmente se están movilizando en respuesta con el virus COVID-19 en nuestra comunidad. Su participación en el Census 2020 es esencial para garantizar que se asignen fondos federales apropiados para apoyar hospitales, escuelas, transporte público, carreteras seguras y pequeñas empresas también. Hacer que cada residente en Long Beach sea contado para el Census 2020 sigue siendo una prioridad para nosotros. Por favor, recuérdenle a todos sus familiares y es la comunidad que completen su Census 2020. Gracias.
Y muchas gracias, y por favor que todos se cuiden en la casa y con tu familia. And thanks again. We'll have our next update on Friday at 3 o'clock. Thank you.